The Quint Leveled Clinical Competency Rubric is a modification of the Lassiter Clinical Judgment Rubric, which was developed as part of a larger, mixed method study designed to explore the use of human patient simulation and its impact on the development of clinical judgment in nursing students. Therefore, like the Lassiter Clinical Judgment Rubric, it is based on Tanner's model of clinical judgment and incorporates the aspects of noticing, interpreting, responding, and reflecting in order to describe students' performance in terms of clinical judgment. The scoring used to evaluate students' performance in each of the areas involves assigning values of 1 through 4, which indicate beginning through exemplary performance. The instrument assesses 25 items that are divided into the 10 areas: focused observation and information seeking, recognizing deviations from expected patterns, prioritizing data, making sense of data, response demeanor, clear communication, effective interventions, nursing skills, nursing evaluation, and self-reflection and improvement. The overall score in each of the areas is determined by the lowest score on any of the items in that area. For example, if a student earns the scores 4, 3, 3, and 2 on the 4 items under focused observation and information seeking, the overall score in that area is a 2. A maximum score of 40 indicates exemplary performance in each of the 10 areas. The Quint Leveled Clinical Competency Rubric does not have a specified place for writing the title and date. For our purposes, please write training scenario and the date in the upper right-hand corner of the page. Now we are going to watch the simulation together, and I will describe how I have evaluated the student's performance during pauses in the action. One thing to notice about the rubric is that it is applicable for both clinical and simulation performance, and the descriptors, 1 through 4, beginning through exemplary performance, are meant to be progressive. For our purposes, evaluating this scenario, the final evaluation will encompass the student's performance over the entirety of the simulation. Let's begin.
Hi Lloyd, I'm Mandy. I'll be your nurse today, and this is Ruth. She'll be helping me.
Hello there.
All right. How are you feeling this morning?
Not very good. I'm very dizzy.
Okay.
And if I stood up, I think I'd fall over.
Oh, that's horrible to have that. Well, the doctor ordered some packed red blood cells, which is going to help with your dizziness. But before we can give you those, we need to do an assessment and make sure everything looks good before we give you the blood.
What does packed red blood cells mean?
It means it's red blood cells that doesn't have the other parts of blood in it, so it doesn't have your platelets in it. It's simply red blood cells.
Okay, and that's going to make me feel better?
Hopefully.
Okay, that sounds good.
All right. Do you want to go ahead and take his vitals for me?
I'm not going to get sick or anything, am I, from this blood? It's been tested. I'm not going to get AIDS or anything.
No, it's been tested for lots of different diseases, and so we're going to also stay here and monitor you to make sure you don't have a reaction to it or anything like that.
What kind of reaction might I have?
You might get fever, chills, headache, and different things like that.
Why would that happen?
Because if the blood doesn't match the blood that's in your system, then your body starts to fight it. Your antibodies, the same things that fight off like colds and things like that, those will fight the blood. But they already came in and drew your blood to do what's called a type and cross to make sure that we do get you the right type of blood. So though it is a risk, we're not anticipating that it will happen, but we'll stay here just in case it does.
Okay, so don't leave me.
We won't.
Okay.
All right. What's your pain level right now?
What do you mean?
Are you in any pain right now?
No.
Okay. Well, that was easy. I'm going to go ahead and listen to your heart and lungs. So just breathe normally. Okay. Take a deep breath for me.
Okay.
Another one. Another one. One more. Okay, then I'm just going to listen to a few back here.
Okay.
All right. So your heart and lungs sound great.
It's good to hear.
Yeah.
Hey Mandy, do you want to record the final signs?
Yeah. Okay, so heart rate 100, oxygen 96%, 98.
So when did you start feeling like you were going to fall over, Lloyd?
Gosh, I think it was really after my surgery. I don't know. Gosh, if I have surgery to get better, I don't know why I would feel so much worse.
Yeah.
And
Who knew that tripping over a hay bale could be so exciting?
that's true. All right, I'm going to go ahead and take a look at your dressing over here. All right, and it is clean, dry, and intact, so that's good.
At this point in the scenario, the student nurse has demonstrated to some degree her focused observation and information seeking and response demeanor. So using a pencil so that I may make changes later, I'm going to indicate a score of 2 on each of the items in the focused observation and information seeking area. The student collected a variety of subjective and objective data, but was unable to identify the most important data for the client's needs. She focused on the most obvious data and made limited efforts to seek objective and/or subjective information about the client. Specifically, she did not pick up on the relevancy of the patient's comment about being dizzy. Under response demeanor, I'm going to indicate a score of 2. The student demonstrates confidence when working with client while providing routine care.
Okay, and I'm going to go get all the tubing and everything ready.
Okay, sounds like a big production.
Want to cross that first?
Yeah. Okay, so why don't you go ahead and read me your number.
001455.
Yep. And I have a Lloyd Bennett,
Okay.
age 76.
Yep.
All right.
And no allergies.
Great. Yep, it's just the pump.
So at this point, we can look back at the rubric. In the nursing skills area, I'm going to indicate a score of 3 because the student displayed proficiency and competence in most nursing skills, including priming and hanging the blood. But she seems to be having trouble with the pump. It is too soon to make a definitive assessment. I'm also going to make a note that she did not wear gloves while hanging the blood products.
I almost forgot to get your informed consent, which the doctor went over with you earlier, didn't he?
Yes.
Okay. Let me get it out of my paperwork here.
And Lloyd, do you know what to look for when you're having a reaction?
Yes, Mandy gave me the list of things there earlier. The fever, the chills.
Yep. So, all right. So the doctor went over it with you, so go ahead and sign down here.
Okay.
Okay, and I will sign. All right. All right. Here we go. So what kind of farmer were you?
Oh, I was a wheat and hay farmer.
Oh. That must have been interesting.
It was a good life, but you're dependent on the weather.
Okay, do you want to take his vitals again?
Here you go, Lloyd.
Are you feeling warm?
I think I might be feeling kind of warm.
Okay, do you have any pain anywhere?
I think I have some pain in my lower back.
Okay, you're having a reaction to the blood. So I've stopped it. Do you want to go call the doctor and the blood bank?
Okay.
There was a lot of action during this short segment. Mandy began the blood transfusion and demonstrated that she was able to manage the pump, so I will update my comments appropriately in the nursing skills area. In the recognizing deviations from expected patterns area, I'm going to indicate a 3 because the student recognized the most obvious patterns and deviations in data and used them to continually assess the patient. In the prioritizing data and making sense of data sections, I'm going to indicate a score of 3 because the student prioritized important, relevant data for the development of a moderately complex diagnosis. She prioritized care within a sufficient time frame.
Hey, Mandy. So I have orders from the doctor to stop the transfusion and run a normal saline, which you already have, and we're gonna do the Inland Northwest Blood Center transfusion report for the reaction. And the doctor ordered 650 milligrams of Tylenol and 50 milligrams of Benadryl for the reaction.
Okay.
And so,
All right. Well, I will get the medications if you want to continue to do his vitals.
Okay.
Just make sure he's all right.
sure. Hi, Lloyd. How are you feeling?
I think I'm okay. I don't feel as hot now. Am I going to get better? Am I okay?
Yeah, we're getting things taken care of, okay? And the doctor's on his way.
Okay.
Hi, Lloyd.
Hi.
I have some Tylenol and Benadryl for you.
Okay, what's that going to do?
The Tylenol's going to help with your fever that you have and help with pain as well. And then the Benadryl's going to help with the allergic reaction you're having.
Okay.
So.
Do you wanna?
Oh,
check?
yep. Can you state your name for me?
Lloyd Bennett,
Okay, and what's your birthday?
5 November 1923.
Yep.
And you don't have any allergies, or?
No allergies that I know of.
All right. There you go. A little water.
Okay, great. Down the hatch.
Okay, so Ruth's gonna go ahead and do some paperwork and ask you a few questions, and she'll stay here to make sure you're all okay, and I'm gonna go talk to the doctor and figure out where we're gonna go from here.
Okay, so I guess I continue to be dizzy, huh? Guess
Well,
it's better than having a fever and such.
yeah. We'll talk to the doctor and we'll see. We might be able to give you, something else for your dizziness or some other blood.
Oh, okay.
Okay.
Okay, I'm gonna now take your temperature.
Okay.
I'm back, Lloyd.
All right.
Okay.
So the doctor ordered some blood samples to be taken.
Now, wait a minute. Why are you going to take more blood out of me when I already don't have enough?
We're gonna test it to make sure that you truly are the type. We're trying to figure out why you had the reaction.
You're not going to take a whole lot, are you?
Nope, just a little bit.
Okay.
Okay, and then I also need to get a urine sample, and I'll have a male NAC come in and help you with that.
This is a time for us to just reflect a little bit about what went well during the simulation and maybe what you could improve upon for next time. So to begin with, what are some things that you noticed that went well?
I noticed that I really stayed calm while there was the transfusion, or after the transfusion reaction, once I kind of noticed that there was one going on. And I think that was really good.
Great, I agree. And then on the other side, what are some things that maybe you could improve upon for next time?
For next time, well, I noticed that I listened over the gown as opposed to under the gown when I was listening to Lloyd's heart and lung sounds. So I should do that next time, listen under the gown. And then I also noticed that Ruth had to remind me to check his ID when I was giving the Benadryl and Tylenol. So it wasn't a mistake, but it was a near miss, something I shouldn't have done.
So in this last segment, the student prioritized getting the prophylactic medications while her assistant nurse continued to monitor the patient. Now let's go back and look at the instrument as a whole. In the focused observation and information seeking area, I'm going to indicate a score of 3 for the first item because the student focused on subjective and objective observations using a variety of data to identify the transfusion reaction, which was the client's most important need at that time. I'm going to indicate a score of 3 for the second item because the student identified pertinent information for assessment. I'm going to indicate a score of 2 for the third and fourth items because the student collected and focused on the most obvious assessment data. So for this area, the student's overall score is a 2. In the recognizing deviations from expected patterns area, I'm going to indicate a score of 3 for the first item. Recognized obvious patterns and deviations in data from expected patterns in the data and generally uses these to assess the client. I'm going to indicate a score of 3 for the second item because the student made adjustments based on client health deviations, the transfusion reaction. So for this area, the student's overall score is 3. In the area of prioritizing data, I'm going to indicate a score of 3 for the first item. Prioritized important, relevant data for the development of simple to moderately complex diagnoses because the student identified the transfusion reaction based on the assessment data. I am also going to indicate a score of 3 on the second item because the student prioritized care appropriately, specifically stopping the transfusion and starting normal saline. So for this area, the overall score is a 3. In the making sense of data area, I'm going to indicate a score of 3 for each of the items. The student was able to use the most obvious data to develop an appropriate intervention in a moderately complex situation. So for this area, the overall score is a 3. In the area response demeanor, I'm going to indicate a score of 4. Originally, while watching the scenario, I had assigned a score of 3. But as the scenario progressed, it became evident that the student responded confidently and provided clear information in simple as well as complex situations. So for this area, the overall score is a 4. In the area of clear communication, I had originally indicated a score of 2 for the first and third items. But as the scenario progressed, the student demonstrated clear and competent communication, including directives and explanations in an increasingly complex situation. There was not an opportunity for the student to demonstrate written communication, so the second item will not be factored into the score in this area. Therefore, the overall score for this area is a 3. In the area of effective interventions, I'm going to indicate a score of 3 for the first item because the student provided interventions that were individualized, evidence-based, and appropriate to the client. I'm going to indicate a score of 4 for the second item because the student monitored the client closely and modified her care appropriately when the client began to show signs of a transfusion reaction. For the third item, I'm going to indicate a score of 3 because the student used evidence-based data from several sources to plan and implement basic nursing interventions as the scenario became increasingly complex. So for this area, the student's overall score is a 3. In the area of nursing skills, I'm going to indicate a score of 3 for each of the 3 items because the student displayed proficiency and competence in performing most skills, but took a bit longer than anticipated to get the pump running. So for this area, the overall score is a 3. In the area of nursing evaluation, I'm going to indicate a score of 4 for the first item because the student independently and consistently evaluated subjective and objective data related to the patient's progress. For the second item in this area, I'm going to indicate a score of 3 because the student did not have multiple patients, which is a requisite for a score of 4. Therefore, for this area, the overall score is a 3. Finally, in the area of self-reflection and improvement, I'm going to indicate a score of 2 for the first item because the student performed a self-assessment. However, prompting was required. I'm going to assign a score of 3 for the second item because the student independently identified her strengths and weaknesses. So for this area, the overall score is a 3. So in order to assign a score, we will add up the overall scores from each of the areas and come up with a 29 out of 40.